Vaccine advisors to the Centers for Disease Control and Prevention are considering a major change to the childhood vaccine schedule.
All right, so the change in the schedule could potentially delay the dose of the hepatitis B vaccine that newborns receive and have received for as long as I can remember now, by weeks or even years.
Yeah, vaccine advisors are a group that was handpicked by Health and Human Services Secretary Robert F. Kennedy Jr., an outspoken skeptic of vaccines. So joining us now with more on what we need to know is ABC News medical correspondent Dr. Darien Sutton. Thank you so much for being here. Such an important conversation. I have an 18-month-old, so we've been going through all the vaccines and stuff. Can you explain why newborns currently get the hepatitis vaccine on the first day of their life? Is it needed now? And what could these recommendations do to change this going forward?
Yeah, such an important conversation. So hepatitis B is a viral infection that specifically attacks the liver. And the reason why we're concerned about it as physicians and providers is because if an infant gets hepatitis B or exposed to hepatitis B, it's a 90% chance that that infant will remain with that infection for their life. And that increases their risk of liver disease, cirrhosis, liver cancer, and death. When we look at the numbers, it's really important to understand the hepatitis B vaccine wasn't recommended routinely universally up until around 1991. Before that, we saw approximately 200,000 to 300,000 cases of hepatitis B. A third of those cases were within children. And it's so important to understand that when we started with the use of hepatitis B vaccinations, the rates of those diagnoses went down by 95%. Wow. And so when you look at these numbers, you look at the benefits and you look at the risk of disease, you understand very clearly that even missing one child should be something that we all should be concerned about when we're talking about these rules and regulations.
Let's wrap our heads around this. So what you're saying is if we delay this for a newborn, they are at risk during that window of time.
Yeah, and I think it's so important that we recognize when we use stigmatizing language as well. A lot of the terms that have been utilized by those who are in opposition to the data are saying that hepatitis B is mainly for those who are intravenous drug users or sex workers. It is so important to understand that a virus does not check your identity before it infects you. It looks for opportunity. And so when you're trying to understand why the language is so important, when you use language like that, you narrow the conversation, you widen stigma, and you increase the risk for everyone involved.
Let's continue to talk about what we know about medical science and not the detraction conversation. How safe and how effective are the vaccines that we have for hepatitis B right now, even in babies and children?
Yeah, so important to understand, because we can't just rely on the idea that since it's printed in a book or in a manuscript or in an algorithm that we could just stick to it. You want to understand the data, and I think that's so important. And that data has been utilized and also by many leading experts. It's been reviewed over and over again. There was a recent panel, the Vaccine Integrity Project. It was basically created after the Health and Human Services Secretary disbanded the Advisory Committee on Immunization Practices. And what that committee did today, experts, they reviewed over 400 studies, and they found that hepatitis B has one of the strongest safety profiles. And if you're considering this, think about all the medications you'll be prescribed or even things you might grab over the counter. A vaccine has the amount of data behind it goes miles beyond the other interventions that we would choose. And in terms of risk, the risk is rare. And the risk most often with hepatitis B vaccines are things like allergic reactions. Now, these are things that are treatable, but what's important to understand is that getting a hepatitis B infection is not curable. And so when you're weighing the risks and the benefits, it's so important to understand why we are using these interventions.
So if the committee does vote to delay or possibly change the birth dose recommendations, what should people do if this is passed and they say, yeah, you don't have to do it for newborns? What does a newborn parent do?
Well, what I would recommend is going and sticking to the data. If the recommendations change today, they would not be based on new evidence. They would be based on new opinions. And in medicine, when you lead by opinions, that really leads you into the wrong category and the wrong territory. So if you're sticking to the data, you're using the leading experts like the American Academy of Pediatrics, who still continue to stand behind the birth dose of hepatitis B. I advise parents, this is not a time to be alarmed, but you need to be engaged in understanding the real risks that your child might be up against, and making these interventions early on in their life can protect them for a significant portion of their life. And also think about the access to health care. Having health insurance and quality health care is not guaranteed, and you don't know what your child will have or what they will have access to in the future, and making these decisions now can be seen as an investment not only in them, but their health and their long-term longevity.
This
So clear, so concise. Thank you so
Really
much for
is
breaking
so
this down.
concerning, and it just is a reminder that we really need to be our own best advocate.
Absolutely.
And we have to advocate for ourselves and our kids.
Yeah, and remembering that the data has not changed, that evidence still stands, and the CDC's data shows that these vaccinations have prevented upwards of 6 million infections and at least 1 million deaths. So it's really important to understand these benefits.
Follow the facts, not the opinions.
Exactly.